This is Pet Life Radio. Let's talk pets.
We are ready. We are live here on Instagram and Pet Life Radio. Here you're live with Dr. Jeff Werber, your host for the next 30 minutes here on Pet Life Radio's Ask the Vets with Dr. Jeff. That means ask me anything you want. That's exactly why we're here. So I'm here for you and for your pets, of course, and just would love to hear from you. Any questions you may have, any problems you've been having, any explanations about a condition or disease. Now's the time to ask. And it's interesting. I get so many of these questions when people come in that I'm often a second opinion. And it's great. Obviously, you hear your name and, they'll say, I asked 4 people and 3 of them, recommended you. So it's great. It's good for my ego, if nothing else. But no, I realize that veterinarians often don't take the time or really thoroughly understand something. And I can't tell you how many times someone will come in and in one exam, they'll say, God, I've been going to my vet for 2 years. I have never got this much information about what the problem with my dog is and why. So you need to get that. You need to understand what's going on, why it's happening. And again, the best, treatment is prevention, how you can prevent things by catching them early. So if you see something that's abnormal, something going on, something that's changed, it's so critical to try to find out what it is, what happened, what was different. I'm watching this new show, for example. I think it's been around a while. I think it goes back to 2022 called The Resident. It's like 6 seasons and I'm loving it. It's kind of like, remember Dr. House MD? It's kind of like that. This young, hot, resident who just is really super smart, and he's the chief resident. And this guy is so sharp, knows so much. And it's really great just because so much of medicine is what, even veterinary medicine, is kind of what he is providing. And he is, to the younger resident, that's the new guy, the Harvard Medical School graduate, he is sort of mentoring him. And at he said one line, this is so great because it's so me. He's talking to this oncologist who's real shady. And if you haven't seen it, I think it's pretty good. But if you like medical shows, of course. But this chief oncologist is very shady. She's a lot of it unethical in what she's doing, trying to get more money because of treating these patients and over-treating them. And you got to see the show. But at one point, she is realizing, probably fake, but she feels that she realized that she did screw up with one of these patients. She puts on this fake crying. It's all BS. Anyway, so his line is, because she said, I don't know, I questioned myself. I don't know how good it is. She goes, no. But she goes, I care so much. And his answer is, and that's why you're such a great doctor, because you care. And that brings me back to a slide that I have, and I think I've mentioned it. And that is, clients don't really care how much you know until they know how much you care. And to me, that says it all, because when doctors are just going through the motions, and they may be really smart, it's nothing against their qualifications, nothing against their training. But if you don't really show sort of how involved you are and how much you really care, it doesn't mean a lot. And it's so important that clients know that. And I find that most problems, when you have an issue with a veterinarian, it's not so much exactly what happened and how it happened or why it happened. It's how they react to the problem, how they try to talk you through it, how they explain things. Because the truth of the matter is, first of all, none of us are perfect. In anything we do, we know none of us are perfect. There are going to be mistakes. And it's not always the doctor's mistake. When you think about this, for example, how many people are hesitant, by show of hands, to not have your pets anesthetized for a dentistry? Even though the data now shows that doing it with anesthesia-free is not going to nearly be as effective. And it's actually a disservice because you can't get in and thoroughly clean the teeth where they need to be cleaned. That's deep into the gums. So what happens is now, after the study came out by Dr. Jan Bellows, a great guy, good friend of mine, and he's probably one of the premier veterinary dentists in the country. And you really see, we need to anesthetize. People say, no, because my friend, she had a dog that went in for routine dentistry and died under anesthesia. And yes, does this happen? Yes, poop happens. We know that. Was it always, or did it have to be the doctor's fault? Maybe not. Maybe not. Because just like a person, animals can have weird reactions to things. It's not even a dose issue. It's just the reaction to the drug that there's no predicting. There's no test first that you can prove that it's not going to happen. And they react differently, which is why in veterinary medicine, when you talk about dose ranges, most drugs have a dose range, meaning, let's say from 5 to 10 mg per kg. all right, or 2.7 to 3.4 mg per kg. Why? Because every animal is different. Every animal reacts differently. And they put data together from thousands upon thousands of cases, and they give us a range that may be working. Sometimes you want to go to the low end. Sometimes if you have a dog that's shown didn't do well on that low range, it didn't work as far as sedation, you got to go up higher. All of a sudden, you're going to get this dog that is so super sensitive that even the low dose is going to be too much. And guess what? You don't know it until you do it. And hopefully, if you start on a low dose, it's not going to be devastating, but it really shows you that there is such a wide difference. So you can't just expect perfection on every single case. I want to get to a question. I want to come back also and talk about expectations, because I find that if you have the wrong expectations going into a case and things don't work out exactly how you expected, then it's going to be dismal. So anyway, hang on a second. So my cloud chaser took my Malamute to the vet to have the histiocytoma biopsies. No cancer. Will keep growing for the next 3 months. It's on his lips. Okay, so how old is this dog again? So it's very important to know the age of the Malamute, and I'll tell you why in a minute. I'll tell you why now. Histiocytomas are very, very common tumors, benign tumors. Let me repeat, benign tumors, usually typically young dogs. And guess what? Oftentimes they go away by themselves. So even if the dog is young and got this, then it's very likely that just tincture of time. How I learned this was just through experience. It was actually my older sister's dog. She probably is, I don't know if I haven't seen her yet, but I know my little sister's here. Hey, Bethany. So with my older sister had a dog who had a histiocytoma, but she was traveling. So we couldn't get to it right away. I said, look, it doesn't look aggressive. I'm not worried about it. It looks like histiocytoma. Let's just wait it out. When you get to act, we'll take it off. No problem. Guess what? After like 2 weeks or 3 weeks, it started to resolve. It was getting smaller and smaller. It went away by itself. And now it is known that, and this was years and years ago, that a large percentage of histiocytomas will resolve on their own. So if they did a biopsy, histiocytomas are benign, okay, which is, I expect that, no cancer. And as far as will it keep growing for the next 3 months, it may, as I said, may go away on its own. Now, another lip cancer, and I hate to use that word because it really isn't a cancer. It's a papilloma, AKA a wart, and oral papillomas, which is very common again in young dogs. And it's transmissible from one dog to another, not to you. Then those also will ultimately resolve, which is why if typically someone comes in with an oral papilloma, a wart in the mouth, on the lips, on the tongue, I say, time out. Let's just wait it out. Unless it's, breaking open, bleeding, or stopping the dog from eating. Of course, they have to work on those. But typically they're benign. They're not causing any problem. Aesthetically, they're not attractive to look at, but they're there. And also what we find, the reason why I don't take them off right away, of course, unless they're causing a problem, is that many of these dogs, the wart that you see, which is why they come in for, is going to go away, but you might get 2 more. And then one of those 2 more might stay, but the other one will go away. And a month later, what I do is I tell clients, we're going to wait until everything is the same, no new ones popping up, no old ones resolving on their own for at least 3 to 4 weeks. At that point, then whatever's left, we'll take them off. Because typically you take it off right away, which requires some sort of sedation. You got to zap it off. You got to burn it. You're going to laser it, whatever. Well, guess what? 2 weeks later, you got 3 more pop up. Now you say, God, what do we do that for? Why don't we just wait? So don't rush into, on young dogs, removing oral papillomas, oral warts. Wait it out. Let's see what's going to happen. Most of them, well, I wouldn't say most, many, many, many of them, I'm being very careful here, will resolve on their own. And you'll end up, even if you have to take one off, it may not be the one you saw initially. It may be one that popped up 2 months later. So, keep it cool. Don't rush. Best way to introduce your dog to teeth brushing. Great question. So here is my recommendation, and that is the following. When you're young, when you get a young dog, you want to make it fun. When you're working with dogs and you're doing something that might be objectionable, you want to change that mindset for the dog's mindset to like it. How do we do that? So first thing I do is I take this pretty tasty toothpaste, which is a dentifrice, non-sudsing, swallowable, because I've never met a dog yet that's going to spit out the toothpaste. And you're going to put your finger in the mouth and just start rubbing around the teeth for literally 5 seconds. And then in your other hand is a treat. And as soon as you're done, you go, such a good boy, you're such a good girl, and give the treat and you're done. That's lesson number 1. Okay. Then what you want to do is do this every day for a couple of days, each time for a little bit longer, not tremendously, just to get the dog used to the process. And you do this each time, and then you start going up and down and around, and as much as you can, always just with the finger and the toothpaste. Once you get to the point where they realize that every time you do this, they're going to get a treat, or they're going to go for a walk right afterwards, they're going to get their meal right afterwards, they're going to probably sit there and anticipate, oh, this is pretty good. Once you get to that point, now you want to put that finger brush on, which is a little rubber sleeve. There are two types, one with the same bristles as the sleeve, which are rubber. I find those not to be as effective, but you can also get them now with actual toothbrush bristles on the end of that sleeve. You put it on and then you do the same thing. You back them out, you go around, inside. And you are just literally, you are cleaning the teeth, but you're making it fun. And they're always getting a treat right afterwards. And then, so it becomes, instead of a chore like, oh my God, no, this is because I'm getting a treat. I'm going to get rewarded. I'm going to get my food. I'm going to go for a walk right afterwards. And they usually will sit there and enjoy it. It's like anything. When you, for example, ear cleaning, toenail trimming, when you start when they're young, then they usually, I wouldn't say enjoy it, or maybe look forward to it a little bit, but they don't hate it. So you're desensitizing them to something that they typically don't like or haven't liked. And you're counter conditioning them to be something that, oh my God, they look forward to this. So when they see that toothpaste, they see that finger coming, they know right away they're going to get their treat. So whether it's a toenail, whether it is a toothbrushing, whether it's ear cleaning, whether it's, well, I'm not saying you should learn how to do this because you probably are going to hate doing it. Anal glands, you might want to say that for the groomer or the veterinarian, because I've heard so many people there, I'm not doing that. Or all you do is got to get squirted in the face just once. And you're saying, this is not for me. And I don't blame you. I even hate it. And I've been squirted in the face. Trust me. It's not enjoyable. So, but anyway, those are the things that it's really great to work with them and get them to like. So let's see other questions. I've got a lot of people saying hello. Hi to you all. I'm trying to wave back, but I want some questions. Right. So what I wanted to do is talk about the expectations. And I find that oftentimes, for example, I had a client recently and the dog needed some major orthopedic surgery. I actually called in one of the orthopedic surgeons that I work with. And this dog had an issue. It was a rescue dog. Something was not fixed properly and had almost like a reconstruction of an old surgery that failed. It was done in China. It was a Chinese rescue. And surgery went really well. The dog actually would walk and then every few steps would still hop up its leg. But when it was placing the leg, it was actually weight bearing, which was really cool because it was way better. Just within days after surgery, it was way better than it was. And the dog was doing so much better. Now, as with any orthopedic, you can imagine almost any surgical procedure, if you've ever had one, what's your rehab like? Are you expecting to get up and start hitting the basketball court or the running track the next day or 2 or 3 or even a week later or even a month later? Heck no. But for some reason, people think that when you do a surgery on a dog and it's a very successful surgery, they should be up and running the next day. Well, I had a call with the video and it shows me the dog walking, hop, walking, hop, hop. And I'm thrilled because I'm not looking at the hopping. I'm looking at the walking. And that dog was completely bearing weight, was not doing that before. And of course, it's still going to be tender, right? And I said, this is fantastic. She was writing me concerned that it didn't work because the dog was still limping or hopping up. And I'm saying it's all about expectation. You not need to know that any procedure, I mean, I marvel at a female who gets spayed. And people ask, when should she be back to normal? I said, well, I would like to tell you, you got to take it easy for her for at least a week, preferably 10 days, maybe even 2 weeks. But she doesn't know that. She is going to want to start running around, doing whatever she does within a day or two. So you have to be her brain and you have to not let her, because the healing's still healing. It was still a cut through the body wall and a cut through the skin and you have stitches inside. You can't let them just run around, and yet they want to. Now, I remember back in the day, before there was this, the hysterectomy is done now with scopes and vaginal approach and stuff like that. It was a cut in the belly, right? And opened up. And these women were like out of commission for 3 weeks. And here a dog is ready to run around a day or 2 later. So it is amazing. Also, they don't complain because who's going to listen to them? But anyway, it's all about expectation. And you're always going into something, just know and talk to the doctor. Find out exactly what is rehab going to be like. What should I expect? What should worry me? At what point should I be concerned? These are the questions you want to ask. Don't just leave after a very successful surgery and think success means, oh, they're back on their feet tomorrow. It's not going to happen. Anyway, don't go away. We'll be back after these short messages. Be right back in a few minutes.
Take a bite out of your competition. Advertise your business with an ad in Pet Life Radio podcasts and radio shows. There is no other pet-related media that is as large and reaches more pet parents and pet lovers than Pet Life Radio. With over 7 million monthly listeners, Pet Life Radio podcasts are available on all major podcast platforms. And our live radio stream goes out to over 250 million subscribers on iHeartRadio, Odyssey, TuneIn, and other streaming apps. For more information on how you can advertise on the #1 pet podcast and radio network, visit PetLifeRadio.com/advertise today.
Let's talk pets.
Let's talk pets
On Pet Life Radio.
Pet Life Radio.
PetLifeRadio.com.
Welcome back here at Pet Life Radio. We're just talking about plastic surgeries in the dog and had a great case this week. It was a Cane Corso that the upper and lower lid had severe entropion. Entropion is an inward rolling of the eyelids. So the hair around the eyelids are rubbing against the eyeball and causing much discomfort. And this dog was squinting and just you could see how uncomfortable. It was so sad. So the problem was the lower lid was not only rolling, but it was longer than the upper lid and was like folding like an accordion. So we had to do 2 procedures on the lower lid, only 1 on the upper. And that was, we had to do a wedge resection on part of the lower lid to shorten the lower lid to make it match with the upper lid. And then we had to evert the lid. We're waiting for it to heal, but I sent pre and post pictures and it's really cool. These are the cases that I love so much because when you have a surgery that's not, well, again, some of the surgeries we do are life-saving. You take out that bleeding spleen, that's a lifesaver. You take out that tumor, that either a lifesaver or is buying a lot of time. When you have things like this that just make the pet instantly feel more comfortable, it's also such a great feeling. And this dog woke up, just the fact that it didn't have to squint anymore and it was able to blink normally and it looked, it looked better too. Part of the bad looking was the fact that it was hurting him. He was always walking around squinting. But anyway, those are really, really cool cases. So a little stronger than squint for an old dog who has arthritis in the back legs. Yes, so New York Yankee wants to know, we talk about using glucosamine chondroitin. Is there anything stronger for an old dog who has arthritis in the back leg? So the answer is yes, there is. So when we're treating arthritis, there's a number of things that we're dealing with. Number 1 is the actual joint itself. We have inflammation in the joint and the joint surface is affected. So again, what we like to use, Dasiquin, for example, a very great product that is a polysulfated glycosaminoglycans. For short, we call it a PSGAG. And that is what chondroitin, glucosamine, MSM, they seem to do. So 100% you want to continue Dasiquin. Now, what else could we do? Well, typically, and we still have an option, and that is let's control the inflammation. 2 ways to do that. We have steroidal anti-inflammatories and non-steroidal. And of course, I am a fan of non-steroidal. And now there are a number of good non-steroidals out there. There is, originally Rimadyl, now it's Vetprofen and Carprofen because Carprofen is the actual drug, obviously related to ibuprofen, which should not be used in veterinary medicine. Got to be really careful. Aspirin, minimally. Tylenol, never, especially with a cat. Tylenol will kill a cat. Let me repeat, Tylenol will kill a cat. So you got to be really, really careful. So we have the glycosaminoglycans. I would add that. I would add the non-steroidal anti-inflammatories. There's a newer one out there since old dogs also often have problems with liver and kidneys. So it's important to note that when you have a liver and kidney issue, we need to be more careful because of the metabolism of these medications takes place in the liver and or kidneys. And they excrete whatever through the kidneys. So there's a new one called Galliprant, which supposedly is easier on the kidneys and the liver than some of the other traditional ones like the ibuprofens. I typically use the meloxicam. Meloxicam is a good one. I like meloxicam also because that is available through human pharmacies as well, because meloxicam is used in human medicine. The Vetprofen or Carprofen is not. So that you have to go to a pharmacy that sells pet products or an online pet pharmacy, or of course your veterinarian. Meloxicam can be prescribed. Galliprant, again, that's a new one, and that is through the veterinarian or through veterinary channels, but it's easier. Now, we have a new one, something new that I really, really like. Again, go online because you're going to see horror stories, as with any new drug. Here it is, 20 plus years later, and Rimadyl, Vetprofen, Carprofen is still on the market because it's really good, really effective, but it got blasted early on. And it was unfair, and it was a mistake in dosing, and you got to be really careful. The new medication is called Librela. Librela it's an immunotype therapy. It's an injection administered by your veterinarian. It is good for 1 month, and it actually attacks the pain receptors. So not only when you have anti-inflammatory, now, anti-inflammatories are often considered analgesics. They're really not. The way they reduce the pain is through reducing the inflammation, but they don't technically, specifically attack pain receptors or the release of whatever mediators are causing the pain. So Librela does. And so Librela attacks the pain. The glycosaminoglycans, like the Dasiquin, help heal the joint surface. And of course, the anti-inflammatories take away the inflammation. The question is, do you need something stronger than Dasiquin? No, it's a dose thing. Now, one other medication that is the original glycosaminoglycans that I really, really still like, and we use it in conjunction with Dasiquin, it is Adequan. Adequan is the original polysulfated glycosaminoglycans. It came from the horse world, where it was given intra-articularly, meaning injections in the joint. Now in dogs, we can give it intramuscularly, and I still really, really like it. So when you have a case that you want to just hit them hard, if it's an older dog and is really uncomfortable, I would consider continuing Dasiquin, maybe adding some Adequan, speak to your veterinarian about it. Then, of course, either meloxicam or Vetprofen or Galliprant for the anti-inflammatory property. And finally, think about Librela for actually pain. So that covers everything. Now let's go to this for Martineau. A 12-year-old boxer, do you still recommend being put under teeth cleaning? I'm scared. The answer is yes. A qualified yes. Number one, the first thing we do with any older dog is not do or not do because of age. That is right there. That's the biggest mistake we make. And I'm not going to go back for the millionth time telling you the story about my 15-year-old Labrador that I had to put under for a very long, extensive, ugly tumor removal procedure. And he not only survived the anesthesia, he went on for a year and a half. We finally had to say goodbye at 16 and a half. Did I make the right choice to go ahead? Absolutely. Age is not a disease. Now, however, before knocking out a 12-year-old boxer, that's old for a boxer, is we need to do blood tests. If the bloods come back fine, liver, kidneys, red cells, white cells, he's in good shape. There's no organ dysfunction that is going to challenge our anesthetic protocol, then yes, I would proceed. So where does age come in? Age comes in for what we use for anesthesia. What induction agent are we going to use? What gas are we going to use? Are we going to use sevoflurane? Are we going to use, isoflurane? What are we going to go with? Induction. Do we really want to drop down the blood pressure high, or do we want to put them on something like propofol? Or do we want to mask them down where we're not using any induction agent? You get the IV catheter in, get the fluids going. Of course, any dog under anesthesia should have IV going, and older dogs even more so. So I do not make a decision to do or not do based on age. I do it based on condition, based on their blood work, based on many factors, and how bad the problem is. Now, if the risk of trying to take care of a disease or a problem is worse than the problem, then we have to think about that. We have to talk about it. But ignoring teeth is dangerous. Why? Because the bacteria in the mouth, depending on, again, how severe the oral infection will colonize, and they colonize often into the heart valves and into the kidneys. So cases of bacterial endocarditis or bacterial glomerulonephritis, kidney infection of the filtration apparatus of a kidney, those bacteria often originated from the mouth. Do I want that happening? No, I don't want to not clean teeth and then end up with endocarditis, because that's a killer. So therefore, if the bloods are good, talk to your veterinarian, and it would not stop me from doing a procedure if the bloods are okay. If everything else is okay, I will just be very careful with what anesthetic protocol we use, how much time we're going to spend on the mouth, etc. but I will not clean them just because of a 12-year-old dog. All right. Hope that answers your question. If you need more information, you can reach out to me anytime. All right. Another question. Comment, it looks like. I love it. Quick, important. My dog with endocarditis. I think it's congestive heart failure overnight, fighting pills and hiding them and secretly spitting. Is he filling up with fluid? I think. All right. Yes. So, yes, that is a problem. And it is very important to drain. If they're filling up with fluid, depends where. If they're filling up fluid in the chest, in the heart, then we're thinking of congestive heart disease, and that is left-sided failure. If we are filling up in the abdomen, then I'm thinking it could be liver or it could be right-sided heart failure. So it's important to know an echocardiogram would be the first thing we have to do. Well, x-rays first. See, what kind of fluid is building up in the chest, where it's building up. In the abdomen, the fluid can be drained. That'll provide a lot more comfortable and make breathing easier. When the fluid builds up in the abdomen, it pushes up on the diaphragm, then the diaphragm can't expand, the lungs can't expand, where the lungs themselves may be okay or decent. So we got to drain the fluid. If it's in the heart, medication, you want to talk to your veterinarian, try to get rid of some of that fluid in the chest, in the lungs, furosemide, Lasix. But again, we need to check the dog out. Otherwise, I would highly recommend an echocardiogram. And that way you can at least evaluate exactly what's going on in the heart, what the valves look like, how the contraction of the chambers are going, how thin or thick the chambers are. It really gives us a better picture. It measures pressures through the heart, how it's going out of the aorta, coming from the pulmonary artery. All these things make a huge difference. So it's time for a thorough cardiac workup. Based on those results, then the appropriate medications can be chosen. In the meantime, just to help with breathing, as I said, if the belly is filling up, you can drain the belly. Your veterinarian can drain the abdomen. If it's coming in the chest, it depends how and where. If it's free fluid, that also could be drained. If it's not, if it's just the lungs getting congested and wet, then we have to look at things like our Lasix and the diuretics, and that can help as well. But very important to see a veterinary cardiologist. I'm sure your veterinarian can recommend a veterinary cardiologist. We have one, for example, that comes to our practice when needed, and we can do the echocardiograms in my practice, which is great, and then gets a thorough report. We know exactly what meds to use, how to use them, when to use them. So that is critical. All right. We recently, if I did x-rays, it's in the lungs. I'm terrified. All right. So if it's in the lungs themselves, if it's free-floating fluid, just to help with the breathing now, that fluid can be aspirated, can be tapped. Again, it's got to be done professionally. Your veterinarian can do it with ultrasound. If not, send to an internist, a specialist. And as far as the echocardiogram, that should be done like ASAP, because there are multiple meds, from pimobendin to spironolactone to Lasix, which is furosemide, to diltiazem, to sildenafil. There are so many drugs that are used to help these animals. And the right combination and the right dosage, that is, usually determined by a veterinary cardiologist. I don't think we as GPs have enough skill to know exactly what and when to use without the echocardiogram. So the echocardiogram, I think, is key. So if you have any questions, reach me offline and I can set you up. All right. Of the bridge at 17 yesterday. Okay, so cardiologist. Yes. 17 yesterday. That's great. I'm surprised that you didn't have a cardiologist before, but I don't know how long this has been going on. But when you get like this, so he's on 5 meds. Please reach out. Let me know what 5. But if it wasn't seen by a cardiologist and an echo wasn't done, it used to be an EKG and x-rays were what we based our decisions on. And we're finding out that's passé. That is no longer effective. I mean, it's not worthless. It's going to help. But there are so many cases in the past that we would see evidence on x-ray and EKG to think these animals needed major treatment and didn't. Once you get the echo, you find out it's functioning hard. It's fine. It's like how many people walk around with murmurs and have no treatment whatsoever. Conversely, we've had cases that the heart didn't look so terrible on x-ray and the lungs didn't look so terrible on x-ray. The dog was still coughing, having issues, and you do finally with echocardiogram, you're finding out that there are major problems. So echo is the way to go. 5 meds, but again, 5 meds is good. I'm hoping that some of these meds are helping, but if you have any questions on there, again, you can reach out to me. All right. Anyway, happy Mother's Day to all you moms out there. Have a great day. We're having a little barbecue at my house with my kids and grandkids, and hope if you have moms, happy Mother's Day. Don't forget them. and I saw a really cute card. My mom's not around anymore, so I couldn't wait give it to her. But the front of the card shows a kid licking the mixer, the beaters on the mixer, and it says, "Good moms let you lick the mixer." You open it up, it says, "Great moms turn the mixer off first." I thought that was cute. Anyway, all right. So if you have any questions, you can reach me during the week. You know how. Otherwise, thank you for joining me here on Pet Life Radio. And again, happy Mother's Day to all. And we'll see you next week. Same bat time, same bat channel here. If you have something urgent, please don't think you have to wait the week. Of course, I would love you to share it anyway, but we can talk about it anytime during the week. Get a hold of me here on Instagram, here on Pet Life Radio. It's Dr. Jeff at PetLifeRadio.com. Instagram, Werbs_DVM. Tell your friends about Werbs_DVM. Have them follow. We love to have the followers. And that way, the more people follow me, the more people I can help. And that's my goal. All right. Thanks a lot. Have a great week. And again, happy Mother's Day. See you next week.
Let's Talk Pets every week on demand, only on PetLifeRadio.com.